Hey guys, Dr. Sony here, and today I'm just going to be doing some cheek augmentation, and this is just a fabulous procedure that when done right, it can just give you a little bit of a lift, a little bit more definition, and a little bit more volume augmentation. Typically I like to use products like Restylane Lyft or Voluma, and usually when I do the cheeks, rather than using needles, I like to use cannulas just because they're a lot safer to use. So I've already made my markings because we want to make sure we get an equal and congruent fill on both sides. So I'm going to start with the right side first. I've already gone ahead and just given her a little bit of anesthesia with a little bit of lidocaine over here. So when we do these procedures, rather than putting the topical cream on there, which you may have had in the past, I'm only going to be poking her in one area. And from this one area, I'm going to be basically filling this entire malar and cheek region. So she's numbed right now. She's going to feel a little bit of pressure. And I just basically use the needle to create a little bit of that poke, and that provides the entry point for me. And through that tiny point, and you can see a little drop of blood there, that's where we're going to be going in with the cannula. The cannula is kind of like the needle, but it's a blunt tipped instrument, so that tip is not sharp, it's actually dull. And the importance of this is typically it causes much less bruising, and also when you're working near vital structures like the eyes and other blood vessels in the face, it minimizes the risk, especially a larger 25 gauge cannula like this, of accidentally injecting an artery or going through the blood vessels. I mean, it can still happen, but typically the risk is much less. And also the pain and discomfort with it is much less. Most people will only feel a little bit of pressure. So here we can kind of see that drop of blood, and that's kind of where I'm going to go in. And because it's a blunt tip, you do have to kind of work it in there a little bit. And we're in right now. Perfect. And now, once we're in, I can kind of see the tips right there, and I'm just going to start filling. And again, we're just putting kind of small drops in there, and we're just giving her a little bit more definition in the cheeks. And then I can back out a little bit, reorient the cannula a little bit. And Sandra, you're doing fabulous. And so this side is done. So you can already see a little bit of the definition that's formed here. And once I'm done with the other side, I'm actually going to come back and massage this out a little bit so it contours to the face a little bit better, and it's a much smoother and an even line. So now we're going to go to the other side and finish that up. It's the same thing here. You can kind of see that drop of blood where I initially gave her a little bit of anesthetic. And we're just going to use a tiny needle. And we're going to create a poke. And now that, and you'll kind of start to see a drop of blood kind of come about there, and that's going to be our entry point. We can just use a little bit of pressure. And again, we're in. I'm going to use a pencil point motion. And I'm going to start filling. You're going to feel a little bit of pressure. You're doing fabulous. Now the other thing this accomplishes by creating a little bit more volume and lift, it also supports the eye structures a little bit better. But right now we're just being conservative. We're just doing about half a syringe on each side. Sometimes, you certainly could require a little bit more for optimal correction. We're almost done. I'll just pinch the skin a little bit to advance. This side is done also, and you see we just kind of did the entire volume filling in here through this one poke. So next what I'm going to be doing is I'm just going to be massaging the area with a little bit of gel, and what that allows me to do is just help kind of shape and mold the product a little bit to the contours of her cheeks. I'm just going to be putting the bed down a little bit. The hard part's done, you can relax. So we use a little bit of gel, we kind of put it on here, and I can feel the product and just kind of contour it just a little bit more. And same thing on this side. Again, this contouring action just helps create overall, how was that? How was the pain?
Very minimal, yeah.
Very minimal.
Yeah, just a pinch.
You felt just a quick pinch?
Yeah, no, it was
mainly
really
pressure.
Yeah, it wasn't uncomfortable.
Okay, guys,
Yeah,
thank you very
good.
much. And thank you, Sandra.
Thanks a lot.